thinking your background in NQF, so what are the quality measures, or how do you even assess quality in that televisit kind of environment?
Yeah, so we did do some work on that at NQF, so I'll quickly plug NQF and would recommend there's some great reports that people can get access to. I think from a quality standpoint, there are sort of at least two opportunities. One is quality measures can generally be more inclusive of the tele encounter, right? So we have now seen, because of the experience of 2020, telehealth use skyrocketed. I believe it's here to stay, even with the numbers kind of coming down a bit and leveling out. I think there'll be sort of a permanence to that. And I think when we have other measures, whether they're measures of primary care, care coordination, et cetera, I think telehealth can be much more a part of that, right? So when I think back to NQF, a lot of our care coordination measures still mention fax machines. We have to stop doing that. We are the only industry that has codified the use of fax machines and continues to codify it. I'd love to see telehealth replace that as as an example of how to coordinate care, whether it's telehealth or digital apps or whatever. As another exemplar of care coordination, that's someplace that we could sort of make a change in the near term. And then the second broad area of change for measures is telehealth specific measures. And I think we need to see more of those being created so that we are assessing quality in the tele encounter in a way that's specific to that. It makes sense for the telehealth visit, and patients can understand the kind of quality of care that we're getting. So there is actually a whole kind of report on that. And I think one important caveat that really emerged from that work is, on the one hand, yes, we do want telehealth specific measures or digital specific measures. On the other hand, we don't want to hold those encounters to a different standard, right? It should feel very much like you are still going to an office, still going to a clinic, a care setting, in terms of your expectations as a patient, maybe even a little bit higher expectation, right? Like the accessibility should be higher, the kind of the privacy, the quality of the encounter should at least be the same, if not better. So I think yes, we want to measure it in a specific way, but not hold it to a different or lower standard than the rest of healthcare.